I wanted to introduce Johan Cardenas, one of our MBK coordinators.
Hello, everyone. Welcome, everyone, to our Trauma Healing and Learning Series, Part 7. My name is Johan Cardenas. I am the MBK Program Specialist at Public Health Advocates. And today's topic will be about understanding the challenges for boys and young men of color as they return to school. Next slide, please. We would also like to ask you guys if you could add your name and organization in the chat box to please mute yourselves and use the Q&A feature to pose questions for our speakers or the support team. We would also like to give a huge thank you to our sponsors and support organizations. Today wouldn't be possible without them. We just want to say a huge thank you. And for today's agenda, we have a lot of exciting things. We will be having a ancestor acknowledgements from Dr. Tiffany Johnson, a youth spotlight performance by Coley Worrell, about the discussion by Andrew Avila, MBK Sacramento overview and updates by Mr. Ray Green, a panel discussion and Q&A hosted by Mr. D'Angelo Mack, helpful resources, Brother Be Well by Christina Smith, Restarting School with Equity at the Center by Tere Flores, and a youth spotlight performance by Maya Werko, as well as a survey and next steps by Dr. Christina Gilardi, and closing remarks by Mr. D'Angelo Mack. I would like to now pass it on to Dr. Tiffany Johnson for our ancestor acknowledgements.
Good morning, everyone, and thank you so much for joining us. And thank you, Johan, for passing the baton. So in the spirit of truth, transparency, and reconciliation, it's important that we first start our meeting by acknowledging the indigenous peoples who have been dispossessed and displaced from their ancestral homelands and territories due to a variety of colonial and historical reasons. I also want to take the time to acknowledge all of the boys and young men of color who have lost their lives since the last time we gathered, whether due to community violence, police violence, COVID-19, or other preventable causes. They were our sons and brothers, our nephews and uncles, and in some cases, young fathers. We acknowledge their unfulfilled dreams and the potential that was not realized. If you haven't already been vaccinated, please know that this Delta variant is no joke. Youth are getting the virus, many are requiring hospitalization, and some are dying. And so vaccines combined with masking are our best chance at fighting this pandemic so that you don't have to be counted among those who we've lost next time we gather. And finally, we want to take the time to acknowledge the ancestors whose shoulders we stand on today, making room for all of our greatness. We acknowledge our mothers and fathers, grandmothers and grandfathers, aunties and uncles. We acknowledge all those whose art, music, literature, and activism help open opportunities and doors for us and enrich our minds and our hearts. We stand on the shoulders of Sojourner Truth, Malcolm X, Freddie Lou Hamer, James Baldwin, and Audre Lorde. As our youth return back to school, we acknowledge the educators and activists who changed the way our people are educated, including Booker T. Washington, who founded Tuskegee University, and Thurgood Marshall, who was the lead attorney in the groundbreaking Supreme Court case Brown versus Board of Education, and Carter G. Woodson, who established the Association for the Study of African American Life and History. We acknowledge the Black Panther Party, who launched a free breakfast program for children right here in California, paving the way for permanent authorization of a federal breakfast program that has fed tens of millions of children, giving them the fuel that they need to learn throughout the day. We celebrate the greats who we're still blessed to have walking among us, such as Alice Walker, Nikki Giovanni, and Angela Davis. We channel their fierceness, their tenacity, their boldness, and their brilliance. We have such a dynamic panel lined up for you today as we try to understand these unique challenges for boys and young men of color returning to school during this pandemic. And we know that the ancestors are with us today, and we know that they're beaming with pride at all the work that's being done. And so with that, I'd like to turn it back over to our MC, Katie.
Thank you, Dr. Tiffany. So good morning again this morning. And part of the spirit of My Brother's Keeper is youth. And we have our very first youth spotlight, Coley Worrell, one of the many great folks we have planned for you. So Coley, if you could.
Because we like guns, Yeah, and they like us too. Because we like guns, and they like us too. Because we like guns. Yeah, and they like us too. Because we like guns, and they like us too. Because we like guns, and they like us too. Blue lives caused kings to lay in red puddles. They said his coat was dark, and that's what made him dangerous. But their reason wasn't subtle. A dark coat with a brown layer under. They said his skin made him a target. Press for a penalty for what? We know they won't charge it. Frequent escape from repercussion. Exemption from penalty is his sanctuary. No disciplinary. Success has been revoked as an invitation. Put kings behind bars. But we not the ones needing rehabilitation. Because guns like us, but we don't want them to. Say he don't want to face it no more. But he ain't got a choice to. Because we like guns. Yeah. And they like us too. Because we like guns. And they like us too. Because we like guns. Yeah. And they like us too. Because we like guns. And they like us too. So now he claps the Afromat Kalashnikov, straight oblivious to the damage that it causes. He entered the war, but never studied how it started. Now his love for his people and collectivism is discarded. In the grand scheme of things, it's not his fault though. He just got caught up in the cycle. Taught that he is nothing and has nothing to give. The street's the only way to live. There's no hope in his neighborhood. And all positivity is taught to forbid. Now he chased down dead end. Couldn't call a friend. Muzzle aimed at his heart. He put his hands up. He said, don't shoot. Then his life fell apart. Because guns like us, but we don't want them to. Said he don't want to face it no more. But we ain't got a choice to. What's up, y'all? My name is Coley World. I'm a motivational speaker, spoken word artist, and youth mentor here in Sacramento. And it's a blessing to be here. Shout out to MBK, UC Davis, and D'Angelo, Johan as well for having me here. And that piece is really inspired by the lives of the young kings that I mentor and that I work with. And I mentor them from my perspective. My last name, World. World is my mantra, which means create your own world. It means that we can create the life that we want to live. We don't have to just accept what is given to us. And with that being said, I'm so happy that we're here to talk about trauma and healing, because healing is the first step to be able to create your own world and make your dreams come to a reality. So I'm so happy to be able to start off this conference. Once again, thank you, D'Angelo, MBK, UC Davis. And if you want to get in contact with me, my LinkedIn name is Coley World. My Instagram is This Coley's World. My YouTube is This Coley's World. And if you want to book me, my Gmail is thiscoleysworld@gmail.com. Appreciate y'all for your time. Thank you.
Coley, if we were in person, it'd be loud right now, but use your reaction button for sure. For sure. Mm-hmm. So I want to keep it moving and introduce Andrew Avila from Improve Your Tomorrow. We have lots of good partners in the community, our friends of MBK, and Improve Your Tomorrow is definitely one of them. So go ahead, Andrew. I want to unmute Andrew.
Good morning, everyone. Sorry about that. My name is Andrew Avila. I'm a policy and advocacy manager here at Improve Your Tomorrow. I'm going to start off by saying some words about why this discussion is so important. I'm super happy to be here with all of you, to be a group of people who are passionate about children, and specifically, young boys and men of color. So the pandemic by now, it's nothing new, but that doesn't mean that things have gotten any easier or better, especially for our brothers. This is true in many aspects of the lives of our young men of color, with their family and their social lives, and the way these young brothers perceive themselves right now. Whether they envision their lives 6 months from now, a year from now, 2 years from now. So when we talk about young men of color returning to school during an ongoing pandemic, the focus of discussion isn't all about educational performance. It's about emotional health, mental health. An overwhelming amount of stress can even come to affect physical health. As schools begin in-person instruction again, the focus must be placed on the overall well-being of the students. And the only way to do that is by first coming to understand the unique challenges, barriers, the deterrents, and the disparities that student is facing. The students, for purposes of today's discussion, are young men of color. Young men of color have had to grapple with racism, which still lingers, often dissimulated more so than obvious, within many of our institutions and social constructs that we have today. I say that to point because racism is a circumstance that has negatively impacted the life outcomes and educational performance of our young colored brothers. We know that Black and Latino boys historically are the lowest scoring groups when it comes to educational performance. These same boys are about to return to school during an ongoing pandemic after being stuck in home for well over a year. Long before COVID and any other pandemic that's ever existed, to be frank, we all know that many of our brothers have been experiencing difficulties inside and outside of school. So it's justifiable to assume that things aren't going to be any easier for them when they return to campus. Remote learning meant that many students haven't been able to interact with other children, a lot of them having to be isolated at home. Consider that isolation, which school children have experienced during this whole pandemic. And then think about young men of color, who are the lowest performing group. If we want our young men of color to succeed in school and for the rest of their educational career and lives, we need to first understand what these boys and young men have gone through this past year. To protect our brothers from further trauma, from further stress, of which they are already overwhelmed. This is why we're all here, right? To understand our brothers, what they've endured during this pandemic, to identify the challenges, barriers, the deterrents, and disparities that have hindered their progress and well-being, so we can begin to dismantle them. This way, our brothers can learn to heal from the trauma that they've endured all their lives and start healing moving forward. That's why a discussion that we're having today is so important. I want to thank my brothers Keepers Sacramento for giving me the opportunity to share with you all today, in addition to all the other panelists, participants, and attendees for being here. I look forward to a very productive conversation and lots of learning.
Great. Thank you, Andrew. Appreciate that so much. In light of that, I want to actually turn it over to Ray Green, the NPK coordinator.
Morning, everybody. So glad to see your beautiful faces and names. I want to thank, first off, the My Brother's Keeper Health strategy team. You know, D'Angelo Mack, who's been the chair of the strategy team, is really phenomenal. But I have to shout out each and every individual. We can just give them some love in the chat. Many of you may not know them, but you will as we continue to move forward in Sacramento and do these wonderful presentations of spaces to learn and heal together. My name is Ray Green. I serve as a program organizer and officer at the Center at Sierra Health Foundation, where we believe in health equity and race equity. And I just wanted to share a little bit about the vision of why. And I want to thank the young brothers who shared the reason why we are actually here today. You know, in 2014, President Obama announced the launching of My Brother's Keeper. And it was really to address some of the root causes, the barriers in policies, procedures, and practices across the nation. He put a call to action, a challenge out there to city elected leaders to really change it. But we knew here in Sacramento that we could not move forward with solutions if we didn't talk and speak to those who are closest to the challenges, which were our youth and our young men of color. So the My Brother's Keeper Sacramento Collaborative is really just committed to improving the educational, health, social, and economic outcomes for local boys and men of color right here in Sacramento. And we do this through bringing system leaders, advocates like yourself, community partners, some that you've heard from today, and you will eventually hear later on, youth serving organizations and young people together to address these root causes in health, education, employment, justice system disparities for young men of color. And we do this through policy advocacy, we do it through system change and support for effective programs. As I get ready to, talk about just a couple of updates, I wanted to just really share that during this pandemic, it has been tough. I love the conversation that we're getting ready to dive into, because our young people do have dreams. Our young people do have ambitions of being successful, of creating their own jobs, of having a healthy family, passing high school, going into college or a career, and they shouldn't have their dreams deferred. And not only did we mention this in the Sacramento Bee, but I wanted to share that their dreams should not be deferred. And this is an opportunity for us to, in a unique way, address trauma. For some of you to be able to heal from some of the trauma that you may have experienced, or possibly expose other young men of color to trauma unknowingly. Also to be able to create that learning environment and to build those spaces. So in the chat, I'm gonna put a couple of things here. Don't worry, you're gonna get these at the end as well. But it's really a lot of the updates that we want you to be able to get involved. There's other areas that I mentioned outside of the health, but as you know, health is across all of these strategies. But we want you to get involved. So visit our MBK Sacramento website. The link is there in the chat. Sorry for the format, that's just how it shows. And then as students are going back to college, maybe you are a student yourself, we want to talk about the College Connect. After this, we want to send you a link where we would be able to know which college you're currently in, especially if you're one in the Los Rios Community College Network. There's some resources and some pertinent information that you should know about getting vaccinated before their deadline of October 1st. We want to get you access to those community resources and partners that we have here. And we also want to make sure that you're getting engaged with the knowledge from trusted messengers like ourselves as well. So we want to send you that link. Just register, tell us which college campus you're at. So we want to be able to do that. And then the third is this summer, and we've been launching, you've heard from Improve Your Tomorrow. They lead our education strategy. We have the 1300 campaign to get 1300 additional young men into Sac State and UC Davis by a place-based mentoring program at our Los Rios community colleges. And I'm happy to announce that we have enrolled our first cohort of over 120 plus young men of color who will be receiving stipends, wraparound support, and mentorship provided by Improve Your Tomorrow at our community colleges. So you can give some credit in the chat there. If you know young people, if you're a young youth serving organization and you have young men and women, during the summer, we always do our Kings and Queens co-ed basketball league. We literally just kicked off our NBA 2K, which is a virtual gaming league. I put the link there. Send that out. Share that to other young people, high school and elementary. Share that out. We're taking registrations right now, up to 75 youth and young people here in Sacramento. And then importantly, I'm glad that we mentioned this as well. I put a link in the chat for the Sacramento Collab. The Collab is a network for all resources. If you have contracted COVID, if you know anyone who has contracted COVID, there's resources like groceries, resources to be able to support you with funding. But then there's also vaccination clinics, there's ambassador trainings, there's influencer trainings, there's going to be webinars about the vaccine. Should I take it? Should I not take it? We know that our African-American API communities are amongst the highest disparities right now. So we want to make sure that you have those connections to be able to support. And then lastly, can't leave the discussion without any funding. There's a funding opportunity from our partners at the Center from Elevate Youth California. Check that out. This funding opportunity, they're going to be giving grants up to $1 million over 3 years to support community-based organizations and tribal organizations throughout all of California that focus on youth activism, support youth and young adults through mentoring and peer support, and educate communities' social norms around substance use, prevention of harm, and risk associated with substance use. So I just wanted to make sure that you had that. I know it was a lot, but guess what? It's also needed. So I want to thank everybody for the time and look forward to the conversation.
Thanks a lot, Ray. I just wanted to welcome again all 105 of you this morning to our next MBK event. Feels great to be with you all, and 105 of us have shown up on a Thursday morning to figure out how to support young boys and men of color. So that's a great feeling. I want to turn it over to D'Angelo Mack, my friend, colleague, who many of you know. Go ahead, D'Angelo.
Thanks, Katie. Yeah. Blessings, family. It's so good to be in this space again with you all. This is one of the highlights of my life, getting to spend time with you and talk about the pressing issues that concern our boys and young men of color. I want to first start off by lifting up the amazing Healthy Development team. These individuals I have worked with for many years now, and I couldn't put anything like this together by myself. It is all their work, sweat, and tears. We also laugh, we also have fun, but it's their work that brings this together and creates these special moments of learning for all of us. So big shout out to my team. If I had time, I'd name you all individually, but you know who you are. You can raise your hand so folks can see you on the chat. That'd be great. A little hand feature would be nice. But we'll keep this work going. Second, I just want to shout out all of those individuals who are returning. I see a lot of faces of past attendees. We appreciate your support and your constant movement in community around better supporting the lives and growth of boys and young others. So thank you. If this is your first time, we are excited to have you. We hope that this is not your last and you are in for a treat. I just want to also shout out the moms. I saw Miss Katie Gilardi in the room and Miss Madeline Core. Great to have you, Miss Madeline, all the way from Birmingham, Alabama. So we thank you for being in the room. So without further ado, I guess we'll go ahead and get started. We have a tremendous panel of experts with us today to have this discussion around the importance of supporting young folks' mental health as they're going back to in-person learning. I'm excited about these individuals and their work in community, even more excited that you all get to know them. I'm just going to lift them up by name and then give them the opportunity to introduce themselves a little greater. So today with us, we have Brian Mapinski he's a wellness counselor from Improve Your Tomorrow, IYT. We also have with us Ebony Chambers. She's the Chief Family and Youth Partnership Officer at Stanford Sierra Youth and Families. We also have Christian Jacobs. He's with Brother Be Well. He's the clinical advisor there and a marriage and family therapist working with Mental Health California. And lastly, we have Fontanya Heel. She's a social worker at Natomas Unified School District. And so I am tremendously excited to have each of them here with us today. This is what we're going to do, everyone. We're just going to be family today, if that's okay, and really have a fireside discussion about our young people and the pressing issues that may arise as they are going back into in-person learning after being off for so long. And so I want to open the floor. If my panelists can come off mute, I want to give them the opportunity to just say, hey, introduce themselves, tell us a little bit about the work they're doing in community, lift up their organizations or not, and just kick it with us. All right, so we'll start with Brian. Brian, open us up.
Perfect. Thank you, D'Angelo. Super grateful to be here, everybody. Definitely see some familiar faces. Again, my name is Brian Mapinzi. I'm the wellness counselor at Improve Your Tomorrow. The work that I'm currently doing was made possible by a grant through the Sierra Health Foundation. I actually see a couple other folks on that grant as well, Mr. Tim from Rose Family Creative Empowerment, as well as Lillian Glammin from On Track as well, too. So the work that I'm doing is specifically focused on Black and African American identified youth. As you've probably heard, Improve Your Tomorrow focuses on young men of color, but this grant has given us the opportunity to exclusively focus on Black and African American youth. So we'll do that through the mentorship that we continue to do, which is our bread and butter, as well as preventative and early intervention opportunities in regards to trauma, like for the young men that we work with. So I'm just super excited to be able to do that. In addition, getting back into school, which is obviously what we'll be discussing today, and just really moving alongside these young men and continuing to help them grow and cultivate and persevere and thrive, honestly, especially in today's society. So thank you again for letting me be here, and looking forward to it.
Thanks, Brian. I'll pass the mic over to Ms. Ebony Chambers.
Hey, good morning, everyone. Ebony Chambers. I'm at Sanford Sierra Youth and Families, and we provide a number of mental health services to youth and families that are impacted by child welfare, juvenile justice systems, and really support them with system navigation, community wellness, and just a variety of approaches that support family stability and well-being. And I'm excited to be here with you all today and share some of my perspective as a parent.
Thanks, Ebony. And then next we'll go with Miss Fantanya.
Hi, good morning. It's Fantoya, and I'm a school social worker with Natomas Unified School District. And what we do here, I'm at Jefferson School. It's a K-8 school. And I deliver mental health services, school-based counseling services to students here. Also training staff in trauma-informed practices and providing parents with workshops such as like understanding anxiety and depression in students. As a social worker, I'm a change agent and an intercessor between community and vulnerable populations and organizations and systems. I help people who are not really able to navigate systems that they might not understand. And it's very nice to be here. Also a community builder. Thanks for inviting us.
Thanks, Fantoya. Sorry about your name. I know that. I know your name. Sorry. Last but definitely not least, we'll ask Christian to share.
Hello, everyone. My name is Christian Jacobs, and as D'Angelo mentioned earlier, I'm a therapist, along with a project manager and mental health consultant. I've worked, really providing therapy to families and youth in public and private correctional institutions and schools. My focus really is working with those populations, the 5 populations that we're trying to reduce the disparities in. Mostly I'm a project manager and advocate for health equity and behavioral health, and active in the community, educating youth and professionals on mental health, really. As a clinician, I partner and collaborate with other state agencies and community business organizations. It really provide that clinical and consultant position. Also oversee commercial mental health investigations for the Department of Managed Health Care to ensure mental health compliance and ensure health plans are sticking to those health equity practices through those commercial health plans, and really focusing on projects through the Department of Public Health, Office of Health Equity, really by overseeing those various community health business organizations and develop those health equity practices. and also working with the California Criminal Justice on Behavioral Health with juvenile sex offenders. So that's a little bit of work that I do in the community. And thanks for having me.
Great. Great. Thank you all for taking the time to come out and be with us and share your work and share your expertise in working with the population we love and serve. All right, well, let's get into this. We just want to talk. Can we just talk like family? So before we start, just to let the attendees know and audience know, if you have questions, please put them in the chat and we will be very glad to ask your questions to the panel. I want to first start with a question and a question to everyone. And that question would be, what are some things that we should be looking for with young people returning back to school that might be concerning, right? Just thinking about young people going back to school and how they may feel. What are some things that, some identifiers that we should be looking for when it comes to young people's mental health? And I'll start with Christian, if you want to open the question up.
Sure. During this time, during the pandemic, what's really been occurring is really undiagnosed conditions. Over this time, as we've been hearing, depression and anxiety has been at a rise. You see that in CNN, you see that in the news all the time, but there's some other conditions that haven't really been spoken on. And I think we should, as educators and parents, we should really be keeping our eyes out for some of those other underlying conditions, such as agoraphobia, which is the fear of leaving the home. So a lot of children and parents and youth are afraid of leaving the home due to a pandemic. And that's a diagnosable condition such as agoraphobia. Separation anxiety. So for a lot of the younger adolescents, the younger children, 0 to 5, there's that separation anxiety may be a challenge, and some of these conditions may be undiagnosed. And also for some of the older children, some of those personality disorders that may come about, really separating themselves from being able to interact with other people. So I think that's one of the things to look for. And then the next question you're asking is, what are some of the symptoms, right? So some of the symptoms are really communicating with your youth and your students and really understanding what some of those symptoms are. So for example, if you notice that your child doesn't want to go and do the things that they really enjoy doing, if they're in athletics and they like going to practice and all of a sudden they don't want to go to practice anymore, that's a sign of something going on. And I think the next thing is really looking for special needs youth. So for children who may have ADHD, some of these children may have other conditions, really investigating through that school district in that plan what they have scheduled out for IEPs and 504 plans. Have they integrated any other type of services for some of these conditions? For example, Sacramento School District, I know, for example, they have a hybrid program right now where they're offering the ability to do a hybrid. So a student doesn't have to go back to school full time. Some students who have separation anxiety, they may find that, hey, you know what, I actually like staying home and I'm more productive at school versus going back full time. So that's something you really want to investigate and find out from your student, your child, like, are you okay going back to school? And then, and then really investigate that. And then also looking at the social aspects of what that will cost. So it's really a matter of, a couple of things, really being engaged with what resources are out there for your school and your district, what they offer. And second, really being connected to some of the programs that Ray Green spoke of in terms of those resources, how you connect some of those children to some of these after school programs that may help them with their social conditions.
Yeah, that's awesome. Thank you, Christian. And I like that hybrid model. I did not know that there was a hybrid model being offered by a school district. And I'm wondering for myself if other school districts are adopting those types of innovative type of practices. But yeah, thank you for lifting that up. Let's see, Santoya or Brian, you both work hands-on with young people, right? Like you're in schools or you're are very close to schools and touching young people. What are some of the things that educators or education professionals should be looking out for? Christian laid out, a great myriad of things, but to add to that, if you can, is there anything else that folks should be looking out for?
Yeah, I would say definitely direct trauma, that in the event that some of our students have had parents affected by COVID and or have lost someone due to COVID. There are students who are afraid to come to school, obviously, and those that have been vaccinated as well. I would tell educators and other people who work with students to really check in and connect with students, because they may be feeling isolated. There's going to be some social anxiety and a lot of fear and high psychological distress with students. So I know as adults that we can kind of just jump back in and roll with things. However, getting kids back into a routine of being in a structured place is very important. So even with parents at home, if there's things that parents could do to help students get used to the structure and the routines that they're going to have to get back into in school. Also, just being patient with students and checking for safety, checking to see if your student feels safe or the kids you work with feel safe and connected. And those are just some of the things just to look out for with those who've been affected by trauma. And so some of the behaviors may show up as withdrawn or irritable. They can be explosive or just have behavior for no reason, or crawling under the tables, throwing things, and you really can't figure out why. It seems like it comes out of nowhere, but just being able to allow them space to decompress or to feel calm, to feel safe. And if students are not feeling like they are successful, I know, for an example, our school district administered a survey to students 4th through 12th grade last year twice, in the fall once and in the spring. And it measured the psychological distress mainly. That was one of the clusters of questions, but we found a lot of students with high anxiety. And some of the questions that I received, that I saw a lot of my students answering the scale very high on, was that they were afraid to speak because they were fear of embarrassment. So being on Zoom and having to be successful at school on a computer screen was very overwhelming for students, and they didn't feel successful. And therefore, their confidence and self-esteem will drop. So being mindful that students are not always able to perform academically through virtual learning, and being patient with them where they are, meeting them where they are, and being accommodating and trying to figure out where they are right now and what's going to be the best approach to move them forward. Natomas Unified does have a Larry Meeks Academy that's a virtual academy, strictly virtual academy, and it is K through 12. We have that option for families. Also, with returning to school, we have teachers that are reviewing basic things with students before jumping into academia. Additionally, we have some other things that I guess would stand out would be just checking in with your students, seeing if they're connecting. Are they making eye contact? Will they, how do they feel in proximity to other students?
Thanks. Brian, you want to add?
Yes, please. I know Christian mentioned signs and symptoms, and Fantoya also talked about irritability. I think one thing that's going to be key is just identifying general irritability between adolescents, because we specifically work in our college academy with 12 to 18-year-olds, and then differentiating that between irritability, like about going back to school, about being anxious. I also think too, in regards to the young men that we work with, different signs and symptoms may present differently than other populations. So providing parents and teachers and admin like with the tools to be able to notice these things, because let's be honest, like there's no blueprint for a lot of the stuff that we've experienced, especially in regards to COVID. So just giving people the opportunity to gain a greater sense of like awareness about like what's going on, because it's still difficult and things are still going on, especially with the Delta variant. So giving people, again, those tools. And I think that's one thing that I want to focus on with my new role is empowering like parents as well too, to just be aware of the things that are going on like with their young men.
That's a great point, Brian. And there's a question in the chat that I'll come back around supports for parents and whatnot. But speaking of parents, Ebony is sitting in the position today as a parent with young person going back to school, or actually he's back in school. And I'd love to hear, your take on just how you feel about the transition of young people going back into school as a parent, and then anything that you have in place or are planning to put in place to support your student as they're coming back home daily and the effects of being back in person.
Yeah, so my son just went back to school just a couple of weeks ago. He just started back, and a very brilliant, compassionate, intelligent young man that I'm super proud of. And over the last year, experienced a lot of anxiety and pressure of being at home and trying to learn and navigate the school in that way, especially considering that he has additional needs as he's learning that needed to be put in place for that at home schooling. And so going back, he seemed a bit indifferent, but also he's a teenager. So, that also is something that I have to navigate constantly of, is this adolescent normal teenage developmental behavior, or is this, a contributing challenge of COVID, as well as anxiety and the pressures of entering high school after essentially going to junior high for almost 2 years in a pandemic at home. And so as he's been kind of transitioning back into school, some of the things we're definitely being mindful of is those pressures. We just found out, we were just talking to a group of friends yesterday evening, that he's not eating lunch. He just shared, he's working through homework during his lunch break because he's so anxious about making sure he's getting all of his schoolwork done, that he's using times where he should be taking an intentional pause and break to get work done. And so that's something that we had to talk about and be mindful of. I think as a parent, I'm absolutely concerned about health, and the Delta variant, although he is vaccinated, just making sure that he's safe in school, he's masked up, that they're strictly enforcing it. And then I think another, challenge as a parent and as a young Black student is also the complexities of, is he being dismissed in class? Is he being overlooked? How is he being embraced and cultivated as a young Black student in the school setting, which is an ongoing challenge. So I think there's just these multiple complex layers that we're all trying to navigate and make sure that, he's safe, not just physically, but emotionally as well.
That's great. Thank you, Ebony. That lunch thing strikes me as thinking about young people and boundaries, right? Coming back into school, school historically had boundaries, at least as far as times, right? Like, this is the time I had science, this is the time I had math, I had lunch, I had, recess. Being in at home and learning, distance learning, my kid would take classes from her bed, right? Like, her laptop, college student taking classes from her bed. There was no assigned lunchtime. There was no assigned, even, homework time. We were doing homework, all types of. So that's a great point that you raised. Like, are young people going to be able to come in, quote unquote, hit the ground running and get back into a scheduled type of format? So thank you for that. There was a question in the chat that I saw others answering from Cassius But I do want to talk about this. And I'll start with you, Brian. What is the importance at this time of tying young people together with mentors or counselors that could help move them during the returning to in-person? Talk about how important that might be.
Yeah. So when we started doing working from home and school from home in March of 2020, it was of the utmost importance then. And I think as we start to transition back into in-person school, it's even more important just because so much research out there out around social connection and how that is a vital part to not just being a young man of color, but a human being in general. So as we transition back in, the mentorship piece and giving students an opportunity to share that anxiety or depression that they may have, giving them an opportunity to share like some of the negative experiences about returning to school, and having that one person that they might be able to go to, right? A lot of our students go through difficult things, have gone through trauma prior to COVID, and this is a collective trauma that we've all experienced. So really being a safe person for students to go to and be able to share things that they might be experiencing is vital and even more paramount than ever. So through IYT and our programs that we have, it's going to continue to be something that's important for us, and finding quality mentors to give them that space to not just dump things that they have and be resilient, but also to thrive as well too, because we don't just want to experience things and bounce back and experience things and bounce back. Like, we don't just want to bounce back, we want to be able to thrive too. We want to work through those things and be able to grow through those things as well.
That's great. Yeah, for all of our ACEs, or where our adverse childhood experience experts in the room, we definitely understand the importance of mentoring, and statistics showing that pairing young people with caring adults tend to curtail the trauma experience and the effects of trauma that happened on their health later on in life. Being a lifelong mentor, I know just by talking to young people and them talking back, and Coley can probably speak to this as well, how important it is to be able to share, the importance of health benefits of wearing masks and distancing, and trying to do that while you're going back into in-person learning. So definitely appreciate that, Brian. Anyone else want to talk about the importance of mentoring? That question there.
I just wanted to say something really quick on mentoring. California right now, through there's a California Behavioral Health Initiative that's going forth through the governor that's really supporting integrating mental health in schools, and the ability to access that through Medi-Cal, and be able for providers to build that through schools, which is a huge innovation through a CalAIM project. And one of the main components in that capacity is peer support. And they're really advocating the use of using peer support versus just having to access a mental health therapist or a social worker, which are very hard to access. So what they're doing now is saying, hey, you know what? Studies show that peer support is almost as important, if not any, than a specialist or a therapist. So I just want to encourage most of the educators out there to keep an eye on some of this legislation going forward. The California Behavioral Health Initiative that's really providing funding for this too. It's a multi-million-dollar project, and this will really help some of the community business organizations as well to really use that peer support element. And also, as you said earlier, D'Angelo, implementing the ACEs and that trauma-informed care in the social emotional learning too. I know some of the schools haven't adapted the SEL, but there are creative ways for some of the educators to integrate some of that stuff in their lesson plans, or relationship building, empathy exercises, breathing and relaxation and meditation techniques on a break, or negative thought stopping exercises. Just a few feelings journaling. These are some things that could be utilized, even though the school districts haven't adopted that yet. This could be, you could be a little creative in your lesson plan or whatever you're doing with your students.
Yeah, appreciate that. Ebony, you came off mute. Were you on?
Yeah, I agree. The peer mentoring that Christian is lifting up in regards to that, those new opportunities, I think is extremely invaluable. Just in regards to peer mentoring and having youth, I think for even my own son, I can say, here's this group, maybe, they're going to focus on, connecting you and breaking down anxiety symptoms and giving you some coping skills. But there's nothing like, being able to walk through that with someone else that is close to your age range or has navigated that, is still either a young adult or even is trained as a peer mentor in the school setting, that has those skills. And obviously it has some oversight from some caring adults, but just, how important it is for them to see reflections of themselves, and so not just, age group, but also, other Black boys that are also able to express their emotions and feelings and talk through how they're navigating these challenges. And so, really leaning into opportunities for us to be able to get our youth trained up and well supported in being able to offer mentoring within the school setting, I think is absolutely important.
Yeah, I echo that, Ebony, and all you said, Christian. I think that peer support is a game changer, right? Having other peers, it's easier, right, to accept, folks your age or at least closest to your age, sharing the importance of these things. So, yeah, thanks for lifting that up. Antonia, I'm coming to you with this question that was put in the chat, to direct message to me, and that is, do you know of, are there any things that schools have changed to support students in the school district? And of course, you can speak directly to Natomas Unified, but what are some things or practices that have been put in place to help support, boys and young men of color coming back into in-person learning?
Yeah, we also have IYT here at our school site. We have myself and the school psychologist that I work with, where our school psychs not only work with special ed students, but they work with the general education, providing social emotional supports. We also, I know in my school site, we're setting up peace corners in some of the classrooms where teachers are open to that idea, where we're kind of consulting them on creating space for students to be able to decompress and to have a mindful moment. We have a virtual calming center for Natomas, where we have a plethora of activities, meditations, guided meditations, all age appropriate. We have visual relaxation, exercise, music, creativity. It's a quite bit of resources. And there's a lot of breathing exercises. And so on my school site, we have a news that J20 News, and we have little paw reporters where students are able to report out. And so last year we were able to have students learn, especially if it was a student, I tried to select students who were implementing these mindfulness practices, and record themselves doing it. And we show it to the school so that other students would do it as well. And to just try and give them concrete examples. Our teachers giving brain breaks, and teachers modeling some of the mindfulness, and also encouraging our teachers to take care of themselves and to be able to show up for the students. And some additional things, we also, if there's some things that are bigger than school-based mental health services, we have Care Solace, where we refer families to mental health services. And it's a pretty easy process where the turnaround is 24 hours. We also integrate the texting line. I've been able to give that to parents for students to text the crisis line. And trying to think what else. I think that's all I can think of right now. But everyone's just being present and just working on being present and working on handling whatever comes up. We are all back in the building with a full school for the first time in a couple of years. So just being mindful that all these things are coming up. right? Whether it's new cases that are coming up at school or contact tracing or whatever it is, just being present and being mindful and giving each other grace. And obviously being flexible for whatever happens and whatever's coming up with our families.
That's great. Thank you. Yeah, it sounds like Natomas Unified is tapping into a lot of resources and support, and so that's really great to hear. And mindfulness minutes and breathing exercises sound minor, but the impacts of those, I recall introducing those practices with our young people who were victims of violence, and how it caused a lot of change in their lives and in regulating and balancing their anxiety and depression. So those are great tactics or tools to use as well. So thank you for that. You lifted up as well, like support, like thinking about our young people going back, but there's also, education professionals who are coming back, and maybe talk about, if any of you, what types of support or care are out there for adults coming in contact with young people who are coming back. Teachers, counselors, parents, right? Do we know of any supports for those individuals, or any for like Christian and even you, Toya, like what would you recommend support for parents and teachers and whatnot?
Some of the same things that we recommend for students, like we have wellness fitness Fridays now launching for teachers here who can stay after work and exercise. We have in the room that I work in, we have a chair where teachers can come here and decompress and kick their feet up. And it's been real busy.
I believe it. I believe it.
D'Angelo, Fantoya, you touched on a good topic, is that a lot of these things that we're doing are also good for the parents and the teachers. So it's not just for the students, and whether that's even a group therapy or a group healing class for parents that are dealing with issues. So, there's through Sacramento County, there's group classes where you can meet with other parents to kind of talk about your issues, and many of these classes are for special needs youth. So these parents may have, all the parents may share a common thing with, I keep saying ADHD because this is the most common challenge that I've seen, working with kids going back to school, is that, there's been an issue with parents, saying, hey, the teacher doesn't understand the needs. They're automatically trying to go to the punitive and not understand what support they need. And so I think that's one area is, the parents really looking at some of those support groups for themselves, and also looking to see what they could do to get involved in that area. And I also posted in the chat ACEs Aware training, a free training. It's through, there may be others out there, but that's the one that I'm familiar with. A free provider training through ACEs for teachers and parents, just to understand, even though you're not a provider, understand what are the 13 components of ACEs. What are some of the toxic stress categories, and what should you be looking for? So it's good for a parent to attend that, and just to see, what I could be looking at, to kind of point those things out. To, okay, now we should probably go to a professional for these issues. So yeah, that's in the chat.
That's great. Thank you. Thank you for putting that there. Yeah, I'm wondering, Ebony, if you can maybe touch on support for parents. Was your son's school, did they provide you with anything? Did they even ask you to take a survey about young people coming back to school? Was there anything prior to starting that you had to do or lift up for him around mental health? I'm just curious. And then just if you could share the school district that he's a part of.
Yeah, so we're in Elk Grove School District, and they definitely did survey the parents to find out what were the needs. they started surveying pretty almost immediately after we went into the lockdown and everyone was at home. They tried, I think, to offer some mental health resources, some groups, but I think based on low attendance, a lot of them were shut down, pretty quickly. And I think that just speaks to, the level of engagement youth have in trying to step out of their comfort zone, especially in virtual environments. I think moving forward, they over the summer, they held some recreational activities, which was helpful, I think, for a lot of youth to engage in. But I think, based on not knowing what the feedback was from everyone, I know what I offered. I know how I show up, right? I know the level of advocacy that they know me. So they're going to continue to know me. And I think that's another important, factor to student success is, really making sure that, they know my face and that I'm going to continue to be an advocate for my son's, not just his education, but his wellness on campus. I haven't seen, as many resources specifically for Black students that I think they could do better at. And I think that speaks to kind of Lillian's kind of that school to prison pipeline and concerns around the suspensions and what kind of focus they're really putting for Black students that we know, is why there's so many students being suspended. And so I think there's more work to be done with that, especially in Elk Grove School District. I know in all of the school districts, but I think that's just to be continued and something we all have to keep an eye on.
Yeah. Thank you for that. You definitely bring up a concern that I have around the disproportionate amount of discipline that happens for boys and young men of color. And when we were researching this topic, we kind of pulled the school district responses to COVID and kind of read over them. And San Juan Unified School District specifically, we read that there would be disciplinary actions that occurred for breaking the mask mandates in schools, right? There was like a 4-step process. The first step was a warning. The 4th step was suspension, right? Which sits, very heavily on this is, moving us into the wrong area type of meter. I'm wondering if we could talk about if we know and if we can talk about better support in the sense of for schools and maybe speaking to schools around discipline or around how they go about mandating or supporting young folks, maybe some alternative ways. I definitely don't think that suspending a young person for not wearing their mask over their nose and mouth, is the right way to go. But we also know that these are things that need to be in place to keep folks safe. So if you were to be talking to a school district or a school, what advice would you give them as far as supporting young people outside of disciplinary actions? That's a big question. I'll give you a second to think about it. While you're thinking about it, I just want to again encourage everyone, please put your questions in the chat. We have a little more time. We're almost finished here, but we want to hear from all of you around questions you might have working with young people, having young people yourself, returning to in-person. So please continue to utilize the chat. I just dropped a loaded question on a lot of you. But in a perfect world, if you were, advising these districts, what would you ask them to do outside of discipline? Is it too loaded? Is it too heavy?
I mean, I think we have to start with that restorative work, right? And really, I think if we're saying, oh, you're not wearing your mask, that then there's some education around that's the first step, not not a warning, but making sure that the youth have the information and the tools, right, to equip them as well. Do they have masks at home, right? How many, are they clean? Do they understand the impacts? And how can we then support them through, getting that understanding if that's a need for them? I think Agnes elevated, like, there's some fears around taking mask off, but also what does it mean when they have it on, and how can they communicate with their peers? And so I think we have to do more understanding of the youth's needs and the family's needs before we move into, punitive measures and discipline that, really could be something around education. And so I know that is a loaded topic. I saw everyone else's faces like, where do we even start? Because there's just, it's such a need. I think, I've got a family member who's second grader was suspended for taking a book from the library a few years back. And so those are those issues, right? A young student of color is being criminalized for, taking a book when he could have volunteered at the library after that, and then had an opportunity to be able to understand where the library is and that these books are something he can borrow. And so that leads itself to that bigger issue of making sure that families have resources and are educated and have the knowledge that they need.
That's great. That's great. Thank you, Ebony. Christian?
Yeah, I was just going to say, I think it's really a collaborative effort, right? It's not, I don't think the onus falls on the parents. It doesn't all fall on the schools. It's a collaborative approach. And what I mean by that is, it's contingent upon us as parents, right? And the community to ensure we're at these school board meetings, finding out what are the schools doing to create a less of a top-down approach. When I say top-down approach, I mean, with students, all they do is they get the rules, they get the laws, don't do this, and then that's all they know. They're not explaining the process behind it. So if the schools were able to, be more a little innovative and say, let's create a forum for the kids to come express why they don't want to wear their mask, which will create an educational opportunity for the school to say, here are the facts, because a lot of the students they may not be getting the facts at home. They may not be watching CNN. Their parents may not be watching the news. They may not be following CDPH. They're not following some of the health guidelines, and they may be going off of myth and memes and social media and internet versus some of the things that are going on in our community that are factual. We the people of color are more likely to suffer from COVID-19, things of that sort. And so with having that platform at the school will allow the school to educate, saying this is why you should wear your mask because of A, B, and C. And then at that point the students will go, oh, okay, we understand a little bit more. Therefore, it may encourage them more to either want to wear it or create an area where they don't want to wear their mask, or have an area where they're, explain how vaccinations working. So it's just opening the avenue for students to talk and share why they're feeling what they're feeling versus a top-down approach. Wear this mask because we say so.
That's great. That's great. Thank you, Christian. Anyone else want to tap into that question?
Yeah, I'll hop in if Fantoya wasn't going to. I think that anytime you have punitive rules, do this or else, always going to disproportionately affect young men of color and people of color. And that just feeds directly into the school to prison pipeline system. I think when I heard you talk about that, I'm like, how is this going to be enforced? Are we just going to leave it up to the discretion of the person? Like, that person had their mask down, but whenever you leave it up to that, then people's unconscious biases are going to come into play, like, no matter what. So again, that's going to disproportionately affect the folks that look like us. So I think having an open and candid discussion about how you can create a system where it doesn't have to be this or else, and providing different resources, again, around the psychoeducation and just general education about masks, explaining the facts and things to students, because who knows where they're getting their information from. And a lot of it is maybe myth or miscommunication or misinformation. So being able to create those dialogues and understanding around like where that comes from and really trying to consistently move away from like punitive punishment.
Yeah, that's great.
I would like to add to that I'm sorry, my mama bear came out of a mother of a Black male who went to an accredited preschool where I saw it starting there. And I knew at that point that because I worked in schools, that wasn't going to be a good fit for my son. So just empowering parents and knowing that they have choice, that they show up, their presence is very important, and that staff need to know that this child is loved, right? And someone and other people care. I feel like when parents show up and they're present and they're showing their faces, that's something that's very impactful. It goes a long way. Also as a parent, I participated. My son went to Waldorf school until he got to high school. So that's pretty free. And there really isn't any punitive or any type of punishment. And all kids, there aren't really any labels on students. Kids don't have any, I've heard 8th grade students say that they came into that school in the 3rd or 4th grade because at their previous school, they were having problems, they were suspended, they were kicked out. But when they got to this school, they never got suspended, they never got sent out of class, and they felt part of I saw kids tear up and parents, families cry, sharing their stories. And so there is a way to make this happen within our systems. I do understand, because I work in the system, that we have policies and we have things that govern us. However, we're people that push the policies. So we're able to be that connection. And so my dream for our public schools are to have decompression sessions, have opportunities where you're giving students voice and choice. If there's a student that's refusing not to do something, because they need to have some choice. They want to, they want to flex their independence and their freedom. So give it to them and find creative ways to give it to them. And I do understand that we have confines that we have to work within. However, once you build a connection with students, and once you can build a connection with families, you're able to come up with creative ways to stay within the confines of the rules that go. So I would like to see decompression sessions. I would like to see every school in this county, if we can, with a wellness room, a wellness center where students can go and calm down. If a student's having a blowout, they're not gonna calm down in 5 minutes, and they're not gonna calm down because you say calm down. And they might not need to calm down. They might need to do something else with their body. So physiologically, they need the space to be able to gain their control and come back to where they can think and they can make better decisions. So having schools be able to have a peace corner in every classroom and have a whole entire room dedicated on every campus for those who need to leave out of the classroom to be able to go before they are going to administration. That's what I would like to see. And I know that that exists in some of the trauma-informed schools that are really taking this work and integrating it within the system, because it is a systematic practice, and breaking down those very punitive legacies that were, that govern our schools. So, yeah.
Yeah, thank you. No, thank you for sharing that. You're right. I mean, we're going back into schools where we can't do things as normal anymore. We have to think about, innovative practices and changes. School has always been, a place that hasn't been supportive in the sense for people of color. And so how do we begin to think about changing the system in a whole to support the diversity of the folks showing up? So great points. There are questions in the chat, and we have little time. I'm just gonna kind of rapid fire here. What would you advise for children of color that are embarrassed or afraid to remove their mask at school and therefore go without throughout the day not eating due to that fear? Is there anything that you could would say to a young person to help support them and ease that fear or embarrassment?
I would ask the student, what makes you feel safe? What makes you feel comfortable? I know we're doing lunch in the quad and outside. So there's little tent, there's shade tarps all over, and then there's the open quad. So they can socially eat as a group, or they can eat at the tables outside and different things. But I always get to the heart of things with students and I say, tell me what makes you feel good. And then I go from there.
That's great. One other
Yeah, I
comment?
second
Go ahead,
that.
Chris.
Oh yeah, most definitely. I think just looking at the mental health perspective, like what are some of the cognitive thought processes behind your thoughts of, why do you feel it's unsafe to eat in this area, and really have them to express why they feel unsafe, and then that will really get down to the root of some of the maybe some of the things that may need more education. They may say, because my mom said that I can get COVID by looking at someone. I'm just being, overanalyzing. But yeah, you don't know what the negative cognitive thought is behind that child's, belief or saying. So again, that gives an opportunity to provide education to the student. And also here's the innovative part right here, that relationship building between the parent and the teacher. So now if that relationship is built early in the school year between that parent and the teacher, hopefully, right? Hopefully the teacher will be able to reach out and say, hey, I know your child is really doesn't want to eat, and they have this belief that they can catch COVID, through this, and then that provides an opportunity to provide education, to the family or vice versa. But it's really that communication component of that opening, talking from parent to teacher, and also from that teacher to the student, being able to educate them in certain areas regarding COVID-19.
That's great. That's amazing. The next question is, for those of us not directly engaged in schools, how might we as a community or community members support boys and young men of color in this time, or support providers or folks doing the work? Are there direct ways to get involved with maybe organizations who are doing work closely with schools or young boys and men of color? In that vein, is there a way for us to get involved?
Well, I can speak on that. I think one of the areas really is, as we were talking about earlier, is if you're not a provider, or if you feel you're not actively in that capacity as a professional, really getting into that mentoring. That mentoring aspect is an option, for either parents or adults, and also again, really being involved with the community business organizations. Asking, are there any forums coming up that I can participate in? Are there any speaking engagements where some of this informational gathering will go forth? So, for example, some of the reducing disparities projects, there are councils where the public is able to attend. So you want to go to some of these events and hear some of this legislation that's going forward, that where we're looking for public information, we're looking for public feedback and comment, and that's one of the main areas where your voice can be heard. And then we're pushed, and advocate for some of these areas where some of these disparities in the school are just tremendous. The boys of color and girls as well are the most underdiagnosed and over medicated. So most of the diagnoses are inaccurate. They act out in class. They slap them with the oppositional defiant disorder. They act out, and they slap them with these explosive disorders, or they're not listening, or they're falling asleep in class. Bam, they slap them with Ritalin. So instead of digging, like, okay, now as a parent who's educated and they've gone to some of these classes, these provider forums. No, it may be the kid didn't eat this morning. Maybe his sugar is low. Maybe he was up all night because the mom and dad was partying, or the brother was partying, he couldn't sleep. So there's so many other elements that as parents that we can get involved in terms of learning what the symptoms are, learning what to look for, keeping your eyes out. So that's one area I would recommend in terms of people who want to get involved through the back door. Those are some things that could be done.
That's great. That's great. I want to take this time to give you each the opportunity to give a last statement, lift up anything you'd like to lift up. We had a lot of questions that we didn't get to on our list, but if you want to just share before we let you go back to your respective busy corners, please, by all means, and I'll let you all start, self-select who wants to start. This modest group. This modest.
I'm best to be first and not last. I think the forums like this that really just help to educate community is so critical to elevating the needs of young boys and men of color, and making sure that the community is well informed, so that when we know better, we can do better. And so I love the question of what can we do even if we're not directly involved, but how do we continue to elevate that? And showing up to spaces like this and continuing to be community advocates in all ways possible. And then, funding is so necessary. We can only do the work so far as ensuring that those that are doing this are it can be sustained. So I would just say that we have to invest more, and then we need more Black men. We need more Black caregivers, providers to also be able to do this work too, so that there's some beautiful reflections of themselves in all of this.
Awesome. Follow that. See, y'all should have went first. No,
Yeah, I just really quick, I think really for educators and parents, meeting them where they are, really meeting your child and your student where they're at, not assuming that they, may know or understand what's going on in the world, and really coming to their level of understanding, I think is the first thing. And then most of all, I should have said this first, self-care. You got to take care of yourself, because and self-care, and I'm sure you've seen memes and stuff about this, but self-care is more than just going to the barbershop and getting your nails and hair done. Self-care is really addressing some of those cognitive thoughts that may be a little distorted, maybe a little maladaptive. So really challenge your thought process. Why do I feel this way? Why is my child feeling this way? And also changing some of the verbiage how you talk to your child. So for example, when your kid gets in the car, right? You get in the car and you say, what's the first thing you always say? How was school today? And if you have a teenager, it's a one word, right? Fine, right? So really changing that thought process, asking them, what was challenging for you today? And then they're gonna have to think a little bit. Tell me one thing. How are your friends doing? How'd your friends handle, the summer? It may have them think a little bit. Or what went well for you in class today. So these are some of the thought process in the language that may have to change in the home. And really just understanding that we want to break the stigma of mental health by talking about it. That's the main thing, especially in the Black community. It's something that, in the Black community, resilience is really great, but resilience can also cause you to feel that you're fine, you're okay. So really just talking about mental health and talking about, a provider and what providers look like, and also being picky about your provider. Culturally competent therapists are out there, and you have the ability to interview your therapist and your provider, your doctor, the same way that they're interviewing you. You can ask them, are you trained in trauma-informed care? Do you have any background working with families of youth and color? Do you have any experience working with boys who've been incarcerated? You could be picky, and it's hard to say that because right now therapists are really hard to access right now. But you do have that option, asking what their provider directly looks like, in the areas and things of that sort. So those are just a few tips that I would provide.
That's awesome. Thanks, Christian. I actually used that practice you shared with me with my daughter. I asked her those questions, and it was a great conversation. So thank you for that. Brian?
Yeah. Lastly, before we all get off, thank you again for having me here. Appreciate being alongside everyone on the call. the thing that first comes to mind for me is just compassion fatigue. I'm assuming that most people on here are serving other individuals and really just pouring out to give everything to everybody. And I think that oftentimes when we do that, we can continue to empty our cup and not refill it, or we don't realize that the cup that we're pouring from might have some holes in it. So for everyone on the panel, in addition to everybody on the call, I think just being able to pour back into yourself and understanding and noticing those warning signs, being like depleted and just like losing energy. The last thing is just really, really, really being there alongside and empowering our young men, boys and young men of color, because we need it and they need it now more than ever. And just really getting them to see that the power that they do have and utilizing the resources that they have around them. I know I talked about like a social support system, like that is going to be important now more than ever as we continue to try and help push them, not just be resilient, not just cope, but to thrive and really be everything that we know and think that they can be. So I'm just excited for the possibilities this year and the opportunities that we'll have. And again, working alongside a lot of wonderful people to make that happen.
Thanks, Brian. Santoya?
I would say for parents, love your child no matter what, even if. And I would also say to anyone that's working with youth, if you're working with young men, do the 10 by 2 strategy for 10 days. If you can talk to them for 2 minutes about whatever they want to talk about, let them lead the conversation. It doesn't matter. It could be a kid that, you know, it's not your favorite. I would start there with those kids and do something like that. And also recognize and eye contact, right? We haven't been able to really see people smile lately and have that connection. And we've been so distant socially and within physical distance or whatever. I say make eye contact, let someone know, acknowledge them, and just, you know, say hi. I feel so a lot of our brothers get ostracized for all type of reasons, right? And so many people have their implicit biases, but going out of your way to let them know you're not afraid of them, to let them know that they are here, and in any subtle way that you can. It doesn't have to be huge, but it could just be as subtle as eye contact.
Yeah. Yeah. Wow. Powerful. Thank you, each of you, for joining us. This was great. This was amazing. Just for those that are part of this is being recorded. We'll make sure we get this out to all the attendees. But let's give our panelists a great shout out in the chat. Send them love for all they do and all they're doing for our young boys and men of color. So thank you again. I'll pass it back to Katie to continue with our day. Thanks again, everyone.
Thank you so much. That was so great. I always get full from being in these spaces. Part of our agenda today is relates to things that were said in the panel, which is, you know, showing up for our young men. And so we've got some sort of resources and other suggestions from some of our MBK partners. So I want to actually turn it over to Tade Flores from Sacramento ACT.
Thank you. Yes, sorry, I was unmuting and turning on my camera. Thank you all for having me, and thanks to Danielle for inviting me into this space to share a little bit about the Reimagine and Rebuild report that my organization, along with other organizations across the state, work together on. Am I able to share slides? Yes, let me see.
I believe so.
Okay, I should be able to. So presenter view. Okay, here we go. So my Zoom. Sorry, I didn't realize I was gonna go right after. Here are So I want to start back up a little bit. My name is Tere Flores. I work with an organization called Sacramento Act. We do community organizing around a number of issues and in areas impacting social and racial justice. One of the areas that we work on and that I particularly organize around is education. Maybe just a little background. We are statewide, we're part of a group called the Partnership for the Future of Learning. Last year when COVID started, we did a needs assessment to hear from parents and students what they needed and what they wanted to see basically from their school districts in terms of resources at that time. We then started working with a few other organizations, and then earlier this year released this report that I can put in the chat as well, the link after I'm done, so you all have it. But basically, it deals with why do we need to think about restarting, like when we go. I know some school districts have already gone back, and I know Sac City still hasn't. But how do we take this opportunity to reimagine is what we're calling and rebuild schools, so that they actually provide the restorative and really like the healing that our students need, particularly right now. We think that, as everybody knows, COVID-19 has had devastating impacts on students and families, and also educators, of course, and the community at large. We know that because of the disruption that COVID has caused, it's also had to, in many ways, force school districts and schools to rethink how they do school. And then lastly, there's a lot of state and federal funding that's coming. Some folks are calling it a kind of once in a generation investment in our schools. And so I think we have a critical opportunity. I know I only have 10 minutes, so I'm not going to spend a whole lot of time in the need because I think most folks already have it, but I can share this PowerPoint that has some of the stats. One thing that I'll share maybe is that we see the impacts in many ways. One of the ways in which we see it is that that more than 1/3 of low-income U.S. families don't have access to both a computer and internet for learning. And we knew that this was a big issue before. It's always been, but I think with what we saw in the last year and a half with education really relying on this, it's created a huge gap. And so I'm going to keep going. Again, lots of stats here, but I'm going to just skip some of them just for the sake of time. One quick thing to know is maybe that also, I know this we're focusing on students, but educators have also experienced declines in well-being. And I think that that's important because at the end of the day, they're the ones that are spending or will be spending a lot of time with our kids, with our students. And so I think, again, we won't focus too much in this presentation on that, but I think finding ways to support and resource educators is also important. So what are we proposing? What have we proposed? Again, based on the needs assessment that we conducted, and then what we continue to hear from students and families, we believe that students return to school, or when they do, in the case of Sac City, who goes back next week, that we need to use at least the first 6 weeks to, first of all, center relationships. So prioritize building, and nurturing relationships of mutual support between families, students, and educators. We also think that the whole child needs need to be addressed. We know that oftentimes in the education system, we focus on the academic needs, and that's obviously really important. But with students going back again with increased trauma, increased stress, increased depression and isolation, and all of those other things that we know, we need to be able to identify, the unique social, emotional, mental health, language, and academic needs of students, and then develop plans to address those needs. We believe that the schools also need to strengthen their staffing and partnerships. So, we think that staffing was not adequate even before COVID in terms of the amount, of counselors and social workers, and other staff that are needed to support student wellness. And even more so now, we need it more than ever. And then we really believe that teaching and learning needs to be relevant. So the curriculum, needs to prioritize equity, racial, cultural, and linguistic relevance, and that it needs to really just reflect the students, that are in the classroom. One stat I didn't share, but in one of the previous slides, is 250,000 students, across the state are in classrooms where their teachers don't reflect their race. So, they don't see somebody that looks like them, in at least a teacher in their classroom. And then the last thing is we believe we need to really empower teams to reimagine and rebuild the systems. So starting with practices, again, like centering relationships and addressing child well needs. But at the end of the day, what we believe we need is just longer term systemic transformation that starts with a collaboration and co-creation among students, families, educators, and community partners. So again, what does that look like? We think we need to start again in the first 6 weeks, but we don't think, then it changes to back as business as usual. But that these first 6 weeks will provide a restorative restart for students. So again, using that period to focus on really making sure that students and educators feel safe. And I know I just heard a lot of folks talk about that. That they feel known, that they feel supported, and that they feel really just fully engaged in learning, because they can't feel engaged in learning if they don't feel safe, right? If they don't feel connected. But again, we think these practices need to continue for definitely the months and years to follow. So we're not just talking about sort of temporary fixes, but ideally practices that are shifting culture and that are shifting, the way that schools are ran. I won't go through everything again because I don't have a ton of time, but maybe I'll focus on this slide. I think one of the ways that we think relationships can start or be strengthened is connecting one-on-one with every family and every student. And again, in this PowerPoint, which I'll make sure to share with you all, there's links to specific tools and resources that that folks can use to do those. So there's like sample questions. There's more information on the parent-teacher home visit project, and there's other resources there. We again believe that in the classroom, there needs to be dedicated time and space for relationship building, both amongst the students, but also between the educators and the students. And we believe that we need to implement positive and restorative discipline practices. So we've been talking about this for a long time, even before COVID. And again, only see that need increased even more now. So I believe I'm at time. And I will just share again that I'll share these resources in the chat, and if you all have any questions, I'm happy to answer them now. I'll put my contact as well. But I think overall, what we're just asking, and not just from our school districts here in Sacramento, but across the state, is for districts and educators to be bold and courageous, and to think outside the box, really, in how schools provide the resources that students need. So thank you. And I'll put these in the chat.
Thank you. I know we're sort of coming to the end, but we wanted to get one more resource in, and we still have a youth spotlight to go. So if you could stick around, we've got Christine Smith from Mental Health California. If you're here. Hi, Christine.
Hi, how are you?
Good.
Good, thanks so much for the invitation. I appreciate you and D'Angelo for inviting me. So I know we have some time limits. I'm just gonna go right into a screen share. I'm also gonna place really quickly some links in the chat so that everybody can access those. Let's see if I can get them in here real quick. There we go. And thank you so much. I'm going to present today on Brother Be Well, which is our mental health for boys and men of color project. It is sponsored by Sacramento County Division of Behavioral Health Services. And we're talking about resources for students, schools, parents, caregivers. This is a wellness for boys and men of color platform that is a multimedia in nature. So we've been in studio for over a year, creating all kinds of content for everyone. Our blog is open to the public. So the link in the chat is for the blog. You can subscribe. If you're a member of the public, you'll see what we're up to. But there's also private areas of the site for people. So for example, there is a, let's see, I'm sorry here. Let me make sure I have it. Yeah, there we go. So we have a private area on our YouTube channel that's only for the males of color. They can access their account. They can get into the calendar, which is being populated with youth support groups, adult support groups, enrichment activities like mindfulness courses, meditation, yoga. We do breathing exercises to center everyone. Here is a list of our advisors. We have a stellar group of advisors for this project as well. And as I go through these pages, I want to acknowledge a person who's been very instrumental in this project. You'll see him throughout our multimedia. He's our content director who's on this call, Michael P. Coleman, who's done an amazing job, and who you also will notice in much of our media is Christian Jacobs, who presented today. You saw how amazing he is, but you should see him in a youth chat or on a podcast with Michael Coleman. So we focus on a variety of topics related to mental health. We are focused on behavioral health. We deal with all kinds of topics, but really zero in on the behavioral health implications, as well as substance abuse. This is our substance abuse prevention and treatment page. We're connected with Sac County for their resources. We know that there's a lot going on right now with substances, especially during the pandemic. And there's also a rise in meth use and alcohol abuse. So we're coordinating our efforts because we know that people sometimes who have mental health disorders, particularly mood-related disorders, often will self-medicate. So the co-occurring issues we try to deal with head on. But we have open conversations. We've had youth involved with our platform. We've had robust conversations. I do believe that these are some of our resources here that are free and open to the public. I do believe that these conversations with males of color need to take place amongst themselves for the most part. That's where they tend to be the most open. So our clinicians are people of color. We also have therapists. We have doctors, we have a person who focuses on nutrition and holistic wellness. So we're bringing lots of experts to this table to get into some deep conversations with our youth and with our adult audience. And so this is our blog. This is one of those areas, members only, where in the chat, when you click on the plans page, you can access scholarships there if you would like to join. It's at the cost of the county for this next year. So feel free to sign up and also to send that to other people. You can see our multimedia in here in this section in our blog, which you've customized. You can search for different categories, podcasts, videos. We also feature virtual reality like the Mushroom Forest if you want to just have a little art therapy and have a little moment to yourself, something creative. This is one on powerful breathing with our mindfulness practitioner, Grace Cecilio. And we also have a Lightbox feature here in our media so that if you want to see some more videos that pull in from our YouTube channel, you can just click on that and it won't distract you with other things happening on YouTube. And of course, some suggestions here. So all of this the media is rich with content, but if you want to just go to our multimedia page, where our audience can hear their peers in podcasts, in videos, they can see them and spread the word and, maybe just listen to it. This is on Asian and Pacific Islander mental health and the expectation on young males in that community and the pressures that they're feeling. This is a story about a traumatic event rooted in domestic violence and the stress that it brought onto someone's family. We've got positive mental momentum. These are our featured medium. This is a great podcast right here. Chronic pain and mental health is a really great one too. And this is for youth, how to distract the distractions, because we know that that's all around. We've got the Capital City Black Nurses Association as a partner doing videos for us on acts of kindness. We have conversations with homeless youth who have challenges in schools as well. There's one on trauma and its toll on the body, which is really important. And again, for a little splash of art therapy and something very cool with a little hip hop vibe, we have our virtual reality, which is designed by our artist in San Francisco named Lisa Padilla, who only practitions in virtual reality for behavioral health. People can contact us through the site as well. Feel free to do so. We're already getting messages. We just launched about a week ago or so, and from across the country, messages are coming in already from people who want to partner with us. Can subscribe to the blog right here. And I'll give you a quick backstage of the membership side of the fence. You cannot get to it from the front end unless you are a member. So go ahead if you would like to. It's only for males of color, 13 and above is the membership. It's a private space for them. So if you're a female, appreciate all the interest, but you wouldn't be able to become a member of it, but you can sign up for the blog and get all of our multimedia. So this is their pages. They have access to the calendar, protected areas of the blog, and they have their own newsletter, and just a little bit on some of the different things that are happening in the Brother Be Well community they can take advantage of, like peer support groups. I'm an author, so I'm going to be personally teaching story crafting, plot planning, and how to tell your personal story. We have Michael Coleman with us doing the BB Dub Barbershop, which is an open forum with different variety of topics. We have the How to Be a Man series. We have a series on naturopathic medicine. And we were fortunate enough to have Sean Monday, who is one of our artists, who is going to be teaching master classes in bass guitar. And he's really incredible. And this is our calendar as we wind down here. I'm going to just show you what one of the entries looks like. So when people become members, then they can go to the calendar and they can just go ahead and click on any of these events that we have and register right here. Zoom will send them their reminders. They can put it on their calendars right here. Very simply designed, and it is made for that for the members. And they will get reminders of our events in the newsletter. We're also going to be doing some live streaming. We'll have some webinars coming up for the public. And right now we are touring with schools so that they can get a better understanding of Brother Be Well, so they can onboard their students. We're talking with schools in Sacramento. And yesterday we just onboarded the Pomona Unified School District, which has quite a number of males of color who will be coming in pretty soon. So we're really happy to just get the word out. And we have curriculum for schools so they know how to navigate and use Brother Be Well We have surveys and pop-ups and reporting and things like that as well. So it's really robust. It's a promising practice. Maybe we'll get it to evidence-based one day, but it is culturally rooted, and can't thank Sac County enough, as well as Sutter Health and Blue Shield for helping us with our forthcoming trauma healing and direct therapy component, because at some point, if a person needs to get into therapy, they need to be able to do it and quickly. So our partnerships help us do that with rapid opportunities to get into behavioral health help and treatment through our partnership with Hear You. That's going to be paid for by Blue Shield. So that's the presentation. Happy to answer questions as well. And I'll look in the chat here to see if I can answer anything, and I'll put my information there so we can stay connected. So thank you.
Thank you, Christine. I'll just summarize by wow, thank you, beautiful. Thanks for being with us. You too, Soraya. I wanted to shout out quickly in the chat, if you could follow the link to our evaluation. It really helps us for our future events. And there will be a slide up at the end if you identify as an ally and you want to join us for that ally space to decompress some of this time, please do that. But I want to shout out to close us, Maya Werko. We want to close and end with a youth.
Do you know your name? No, I'm not talking about the name that your master gave you. Do you truly know your name? Please allow me to remind you. Your name is the generations of sons, fathers, grandfathers, and many greats. Your name was written in a song so your ancestors could sing it. Your name was designed at the stars. Your name carried royalty. Your name is priceless with time. Your name has a powerful traits that only you have access to. Your name is fierce but gentle. Your name is firm but soft. Your name is celebrated but criticized. Your name is vulnerable, don't be afraid. Your name without failure, there will be no success. Your name provides strength and weaknesses. Now is the time to heal your trauma wounds, to discover and embrace who you are. Remember that your name is key to your legacy. Hi everyone, my name is Maya Werko. I'm a leader, I'm a healer, and I'm a designer. I just want to say thank you for MBK. I just want to say thank you to Molly, shout out to her. I just want to say thank you for this, D'Angelo, for giving me this space. The piece is called Say Your Name. And I think this time is the crucial time to remind our students that remember who you are. Remember that your name is royalty, to remember that your name is your legacy, and don't be afraid of who you are, and to really stand tall of who your name really represent. As my display name, I am a print mentor. I'm a print mentor for the first year experience program at Sacramento City College. I recently just graduated there this spring with my AA in transfer in psychology. So I am in the making of transferring to Sac State to go for my BA. And I've been a print mentor for this program for 3 years. We just started the fall semester. They love my work ethic so much. I am present in 7 classes. So yeah, I'm really known for my work, for my community work on and off campus. Yeah, I just appreciate the space. I appreciate the conversation. As a young Black woman myself, I know the struggles growing up in an environment where it's lack of resources, lack of support, lack of finance. And I'm happy to continue my work as a print mentor. I'm glad to be a voice for voiceless. And this took time. I felt like I didn't have a voice when I was young, I did have disability growing up, K to 12, and I feel like teachers didn't understand me. I did have a speech thing too, which probably don't, you guys probably think like, what, where's the speech at? But I did achieve my goals, and I did carry on my disability case in college. No shame in my game. I'm proud of what my story stands, and I'm proud of tapping in all the resources at my school. So that's why I became the mentor at this program. And the program is designed for our first-time college students. For those that are entering college for the first time, I'm here to help them navigate the system if they need help, and mostly in the online environment. We know how COVID had been a big impact on us. Me, I definitely experienced mental health conflicts along my journey. And I had no shame on tapping in those resources. It's free as students, I say less. So I'm definitely I'm there to really be present in these classrooms, to help our first time coming students to navigate the system, help them touch in these resources. At Manual TA, I do not come to me with no math. However, I will guide you to our best math tutors. But that is my role as a mentor. I work with a phenomenal team of success coaches, mentors, and coaches, and counselors to really help our students come back for another semester. Because we all know that most students that come to college for the first time, mostly are young Black men. They will start, but they don't finish. So even though I'm helping a wide diverse of individuals, my target population will always be my people. I'm here to host space. I'm here to listen, and I appreciate the panel. You guys have filled my cup today, and I'm definitely taking that back along my journey. So I just want to say thank you for allowing me to share my piece. Thank you for allowing me to share a little bit about me and where I am in my journey. And I'm looking forward to future projects within this fantastic organization. Thank you.
Thank you so much, Maya. Perfect way to leave it. This was recorded. We will send it out by email. D'Angelo's going to share a slide for those of you who identify as an ally and want to join us for that space. But I want to just say on behalf of the Healthy Development Pillar, thank you so much for joining us this morning. This was great. Good to have you.